But we are yet to hear exact details about when and how this year's most anticipated vaccine will be distributed. Well, joining me now in our weekly TIA Health Medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Always great to have you on the show, Doctor.
Thanks for having me.
Now, it's really encouraging to see these 3 vaccine candidates, but why is Canada unable to obtain these doses as fast as the US or UK?
I think the big issue here is it comes down to buying power. So all the countries are buying in bulk, but if you look at the US population of 328 million and the UK's of 66 million, Canada's buying power at 37 million is a bit low. We also don't have any domestic vaccine producing capacity, so which means we are reliant on buying everything from these companies.
Now, we know that once the vaccine reaches the country, that we'll be prioritizing the vulnerable first. But when do you think the vaccine would be available to the general population after its initial rollout?
Usually in vaccine campaigns like this, the vulnerable populations are prioritized, and the usual challenges are more logistical. So once that is sorted, we would typically see rollout for everyone about 2 months afterwards.
Well, meanwhile, the federal government has invested in a COVID-19 therapeutic drug from Eli Lilly. So can you tell us more on what exactly a therapeutic drug such as this one does?
So the therapeutic drug by Eli Lilly here is bamlanivimab, which is of course made in partnership with the Canadian company AbCellera. It's been approved to help treat COVID by stimulating the immune system to fight better, but it's only indicated in mild to moderate symptoms. So it will decrease the rate of hospitalizations for us from about 10% to 3%, but still isn't necessarily going to be helpful for severe infections.
Now, we are seeing a rising number of Canadians interested in getting vaccinated, but there are still some concerns lingering around, such as the fast rollout and safety of these vaccines. So what would be your advice on this?
I think Canadians do have concerns because this is going to be the fastest rollout of vaccines likely in recent history. The concerns will be around booster shots, side effects, and the concerns are probably a bit legitimate as well. I think it's up to the government and physicians to really educate the public on why this is important, regardless of these concerns.
Now, as you mentioned, a lot of vaccines need a second round of booster shots, and we are hearing that these vaccines likely will have one. So can you tell us more on why it's required in some immunizations?
Yeah, so typically in vaccines, it's like teaching the body a lesson. So in this case, how to fight the disease when it presents itself. Just like any lesson, sometimes you need a booster or a second lesson to help with that there. Otherwise, it just doesn't go into long-term memory, which is why a lot of our vaccines, including MMR and of course the yearly flu shot, needs those boosters as well.
And what are the side effects that may be associated with taking such vaccines? And would these side effects deter people from coming in for a second booster shot?
The participants of the vaccine trials did report high fever, body aches, day-long exhaustion, and these could be quite intense. But for the most part, they didn't last more than 24 hours. So yes, we will expect some side effects. Yes, they probably will be a bit intense, but they'll probably be very short-lasting.
All right, doctor, we've got about a little over a minute now. Once a person gets vaccinated, does this mean that they could go back to their normal routine without social distancing or masking? How is this transition period going to look?
I think it's a great question. Once a person is vaccinated, their body knows how to fight an infection. But just like in real life, just because you know how to fight doesn't mean you pick a fight. So without a high level of herd immunity here, you're not going to be able to help the most vulnerable groups, those who are too young, too old, or too sick to be vaccinated. So regardless of the vaccine, it will be our duty to just continue social distancing and masking until we reach that herd immunity.
All right, Dr. Raut, always great to have you on the show. Thank you so much.
Thanks so much.